Hi, everyone. I'm Maggie McGrath, senior editor at Forbes. The Trump administration has moved to make significant cuts to the Department of Health and Human Services, including cutting billions and tens of billions of dollars from the budget. What effect will this have on public health in the United States? Joining us to discuss is Harry Nelson. He is a noted healthcare attorney and the founder of Nelson Hardiman. Harry, thank you so much for joining us.
Great to be with you, Maggie.
So there's been a bevy of headlines about cuts across HHS. It's honestly can be a little hard to follow. What's your takeaway about where we stand right now in 2025? How much has been cut? How much more is there to come? What's your summation of where we stand?
Yeah, so it's been a fairly radical first hundred and however hundred and so many days. Within HHS, there have been total layoffs in excess of 10,000 employees within the Department of Health and Human Services, which of course covers the National Institutes of Health, the FDA, Medicare, Medicaid. So 10,000 people. We think that DOGE is trying to cut the workforce by another 10,000. So 20,000 total. They have taken the 28 various agencies and divisions, and they've tried to reduce those to consolidate them down to 15 programs or agencies. They've been cutting public health programs, tracking issues like infectious disease testing and cancer tracking and maternal health, and also slowing down vaccines, for example. So it's been a pretty radical period, and there seems to be more to come if we believe the new budget, which would cut funding dramatically by tens of billions of dollars across all these various agencies, representing something like a further, 1/3 or so, 30 to 40% cut of all funding for public health at the federal level.
To ask the question, what does this mean for public health, could be the equivalent of a 6-hour discussion. But in 30 seconds, what do you see as the immediate impacts on public health from these cuts?
I think the immediate impact is that things like biomedical research, which in clinical trials or drugs, for example, at the National Institute of Health, are being absolutely decimated. A lot of the initiatives on just tracking public health in America are being really wiped away, and we're seeing this dramatic shrinking of the of what public health looks like in America. Obviously, it's really challenging from the standpoint of research and drug development, from the standpoint of our participation in global health initiatives, which is basically disappearing outside the United States, to our efforts to sort of monitor and prevent disease. So it's quite serious. There's no question that this is going to be a major limit on access to healthcare and on the future progress that we can make in terms of public health.
Now, obviously, the cuts have been widespread and affect a number of different HHS programs. I was talking to someone a few weeks ago about the cuts to the CDC assisted reproductive healthcare technology team. And this source was saying that that team and that area of study had been a congressional mandate. And I asked a question to her, and she's not a lawyer, so I will ask the same question to you. If there is an HHS program that was part of a congressional mandate and is now something that's being cut, is it legal to cut that program?
Right. That's the $1 million question that we're going to find out. Attorney generals from, I think, 19 states have joined a lawsuit arguing that it's unconstitutional, that essentially they've exceeded, that the executive branch of the administration has basically exceeded its authority and is basically undermining programs that where Congress has already authorized and allocated the funds, and that they're violating Congress's authority and violating the separation of powers. And the test is going to be, for federal courts to determine, where the authority of the administration ends, and where these legislative mandates, what they really require. So that this is a very significant lawsuit, and I do think it's gonna give us a real real picture. There are also some just fundamental procedural issues. A lot of questions about the way that DOGE has restructured without any notice or opportunity for anybody to be heard, not only Congress, but the stakeholders, the people who are directly affected by these various program cuts.
So you just mentioned 19 states attorney general have joined forces in this lawsuit. Are these the 19 states that are most affected by the DOGE cuts, or are they all blue states? Is there any?
These are all Democratic governor-led states, Democratic attorney general states. So I would say these are blue states that are responding. I don't believe that any Republican governor or Republican attorney generals are part of those cases. The lead lawyer in this case is the Attorney General of New York, Letitia James, and so you can imagine the coalition of states that are essentially accusing the administration of sabotaging the Department of Health and Human Services by these cuts.
So they're approaching it from a constitutional question, but you said there are procedural questions too. Are those separate lawsuits, or are those subclauses within this main lawsuit?
These are different causes of action within one lawsuit. Yeah, there's this procedural aspect. Everything that happens in government agencies is governed by what's called the Administrative Procedure Act. Every state has a version of that, and we have a federal Administrative Procedure Act. And fundamentally, what it requires is that every time you're going to make regulatory changes in an agency, you have to give notice to the public and an opportunity for people to submit comments and to be heard before you take action. So it creates a window of time where people have the chance to express their concerns about the decisions, and then ultimately it also creates a little bit of time to get ready to challenge decisions before they become final government actions. So that's the procedural aspect of the case. And then the bigger constitutional question is around things like the separation of powers and the limits of where administration, the executive branch of government, which is charged to enforce and implement the laws, where its authority ends and where the authority of Congress, which makes the laws and funds all of these, decides what the mandates, what has to be done, and then funds it, where their authority is. So those are the kind of twin. Sorry, I mean those are the two twin pillars of this case.
That makes sense. Now, as you talk about the procedural aspect and the regulatory approval typically given or the public notice typically given, I'm also thinking of the private sector. You mentioned drug development, and I'm wondering if there are biotech companies that are seeing their product thrown into chaos or their production line thrown into chaos because of this. So have we seen any suits from the private sector because of the changes at HHS meaningfully impacting business?
It's a great question. I have not yet seen a separate private sector lawsuit, but I guarantee you that as this case proceeds in the courts, we're going to see amicus briefs filed by biotechs, by the pharmaceutical industry, because the changes in clinical research are really radical. I have a number of friends who are doctors who run clinical research labs under grants from NIH. And across the country, we're seeing at major research institutions, those labs are already being shuttered to get in front of these cuts. And so it's really upending the whole world of anybody who does clinical research funded by NIH, which is the leading funder. The money being spent at the federal level grossly exceeds what the private sector spends, and is really like a linchpin of why America is the center of drug development and clinical research, in the country, in the world. Sorry.
The federal spend is more than the private sector spend. I think that's worth emphasizing because as I've talked to sources in academia or even entrepreneurs who depend on NIH resources, that's been what they've been telling me, that there's no one billionaire who could come in and fill the void that has been created by these cuts. So it really is rife. Now, you mentioned amicus briefs, and from a legal procedural question, this might be nitty-gritty, but I'm curious, is it better, legally speaking, for biotechs and pharmaceutical companies to join those 19 states attorney general in that suit in an amicus brief? Or is it better if there are lots of little lawsuits attacking this from different angles?
Yeah, that's a complicated question, strategically, right? Who these cases get heard by, both I do think that, the main show is gonna be this case with the 19 attorney generals. So I do think that is probably the case that's likely to make its way, fastest to federal appellate courts and potentially to the Supreme Court. So I do think that, rather than in general, it's always, lawyers have different strategies, when it comes to challenging government action, but proliferating a bunch of small separate cases it sometimes happens and the cases have to get joined up. But we're usually better off when those cases get consolidated, unless they get consolidated before a judge or before an appellate court, that is really not receptive to them. So you have a funny phenomenon around the country where you do have different federal appellate courts that, that are more and less receptive to claims based on their political shape. But in this case, the Attorney General of New York, Letitia James, made the choice, and so I think the case is as well positioned as as the plaintiffs can ask, and I think that we're likely to see the pharmaceutical industry, biotech, medical device, coming into this case rather than filing separate cases.
So, what's the timeline here? What can we expect in the next days, weeks, and months? Is that, or do we not even have a sense of the timeline?
Yeah, I think this case is definitely going to be accelerated, and the question is how quickly will we get? The initial move by the plaintiffs was to seek a preliminary injunction, so we will have a lower court ruling within the next couple weeks on the injunction, and then likely we'll probably take a couple weeks after that to get to the appellate courts. I would be surprised if we see this in the Supreme Court, by June or July, given what a significant decision, what a high stakes decision it is on both sides. And I expect that this summer we will be seeing the Supreme Court finally, ruling on this issue.
By this summer, we'll see the Supreme Court ruling on the DOGE cuts to HHS. I will have to have you back on to explain everything that's going on then. But in the meantime, is there anything else the Forbes audience should know and understand about the cuts to HHS and any legal action around them?
I think this is a really an important issue to be following closely. I do think it's a complicated story because the Trump administration, is making the argument that we've had government bloat and inefficiency, and that what it's really trying to do is to get to a more efficient system. And of course, these cases are really arguing that this isn't about cost cutting and reform. This is about sabotage. So I think it's really important for people just to be paying close attention and to be expressing, to the extent that people have distinct viewpoints from wherever they sit, into how this is affecting all the different parts of our public health system. I think it's valuable because it will help the public. It will help us understand, what the truth is. And so I just would encourage people to be paying close attention and to be speaking up about how this is affecting them, whether it's in early education initiatives, in disease prevention, and in vaccines, in research. I think there's so many pieces of this, even within just health and human services, that it's going to require a lot of eyes and a lot of voices to understand fully the implications of what we're dealing with and to respond to it.
I lied. That was not my last question. Final question is actually about that injunction you mentioned. If an injunction is instituted within the next few weeks, would that just put a pause on the cuts, or would it give some money back? What would be the state of operations then?
Yeah, it's a good question. Anytime 10,000 people are laid off, those people are immediately out looking for other jobs and figuring out how to, pay the rent or pay the mortgage. So to some extent, it's not clear that positions will come back. But as I mentioned, even though there've already been 10,000 cuts, they're trying to move to 10,000 more, and to reshape these agencies in a way that will also eliminate a lot of positions. So it will freeze the efforts of the government, and prevent the kind of dismantling of so many of these sub agencies. And then it's an open question how much can be restored or what the status. We're going to be in a little bit of a limbo with some of these changes not being reversible until the dust settles here a long time from now.
Many questions remain in the coming weeks and months, but in the meantime, Harry Nelson, thank you so much for joining us and breaking down what we know so far about the DOGE cuts to HHS and the legal proceedings around them. We really appreciate your time.
My pleasure.